Hello everyone, this is Dr. Shyam Purgal. I'm President of National University of Medical Sciences in this beautiful Spain since 2012, and today I want to speak with you why manual osteopaths have busier practices after the COVID-19 pandemic. As you know, many manual osteopaths are now fully booked and they have a long waiting list. Especially after the COVID-19, I hear that from a lot of my students. I myself, we have the Osteopathic Chronic Pain Clinics of Canada. We have 346 clinics in 33 countries, and recently we opened a number of new clinics. 2 weeks ago we opened one in Ireland, and last week we opened 2 in Singapore, about a month ago in Iran, and so many other locations. The reason why manual osteopaths are so much busier after COVID-19 has to do with what manual osteopaths do. We treat last resort cases others cannot help, chronic pain cases, people who had pain for many years, and these are the ones who seek manual osteopathic care as the last resort. And that is why we are busier after the COVID-19 pandemic. As long as there is chronic pain, there is a need for manual osteopathic services. Yes, some people seek medications, some people take injections for chronic pain. I read last week in Toronto, the government investigating a physician, he did 65,000 injections for chronic pain, charged every year $2.5 million to the government. Patients had to go every 4 days to get the injection from him. This is not normal. Nobody's supposed to have so many patients, and that's why the government is investigating him. But there are many other people who do not like to have side effects of the medications, do not want to go through pain of injection every 4 days. These are the people who seek for natural alternative way of treating chronic pain, a type of services that is pain-free, relaxing and highly pleasurable. And this is what manual osteopathy provides for them. And again, as I said, as long as there is chronic pain, there is a need for manual osteopathy. It is like dentistry. If you have tooth pain, you don't have usually much option except either take a medication or do some home remedies or see a dentist. As long as people have dental pain, there is a need for dentistry. The same it goes with manual osteopathy. I see that a lot in my students. Give you an example. One of my students, he graduated from Doctor Osteopathy program we offer here at National University of Medical Sciences, which is based in Madrid, Spain. His name is Dr. Ali Haghighi. He is one of my good students. He studied osteopathy in another school before joining us. This is what we do. Actually, we get a lot of manual osteopaths from other schools study in our schools because the way we teach osteopathy and because of my business lectures. I teach over 200 business lectures to my students, and that's why my students on average make $150,000 per year, which is $60,000 more than other manual osteopaths. But Dr. Ali Haghighi is one of those rare students that I have who owns $1 million clinic. I will in another video speak about him and the $1 million clinic that he created. But he practices in north of Newmarket in Ontario, Canada. He has 16 health professionals working with him, and 2 months ago he had to hire 3 of my students, to 3 manual osteopaths, to help him see all the patients who seek appointments. And I hear that from many other students too. Last month I was in Toronto, and I met a couple of my students, Maria and Adrian, who told me they have now 2 months waiting list it was August, and they said that they have waiting list until October, and this all is because of the ability of manual osteopaths to treat chronic pain. Now chronic pain incidence actually has risen exponentially. I think it's because people been cooped up inside home. Many gyms are closed. People don't go outside to do physical activity, and as a result, those who have pain, their pain becomes more, and they need manual osteopathic care. Also, I think because of this COVID-19, people like to go and get touched by another human being, and that might be another reason why they are seeking manual osteopathic care so much. But all in all, we have seen an increase in the number of patients that we are seeing in our osteopathic chronic pain clinics of Canada, and we also seeing in my schools a larger number of students applying. I think could be because many people in travel industry or other businesses, they went out of jobs, so we saw a surge of students who are interested in studying osteopathy. Osteopathy is a rewarding profession financially and emotionally. Financially is one of the highest paid health professions in the world, and emotionally they treat last resort cases. They provide help to people who could not be helped. So that is why manual osteopaths have the #1 job satisfaction rate with 98% between 25 health professions, and they have the #1 patient loyalty rate of all health professions. Once a patient sees a manual osteopath, 97% of them stay with that manual osteopath for life. That's about it. I hope you enjoyed this video. Thank you for watching this video. Hasta luego. God bless. Namaste.